All right. Thank you so much. Good evening, everyone, and thanks so much for joining our town hall. I'm in Washington this week and wanted to give you an update on what I'm doing to protect Californians' health care. I'm talking about how we can avert this shutdown crisis that Republicans have put upon us. But first, a few logistics. Brooks is a member of my team. She's going to moderate tonight's event. Brooks has spent some time in the Inland Empire. She knows our region. She's going to read some of the questions that you have submitted, and I'm going to aim to answer as many as I can in the limited time that we have. If you'd like to submit a question right now, you can do so by clicking the Q&A button on your screen and typing in your question. Before we get to questions, I wanted to share where things stand in DC right now. As many of you know, over the summer, Donald Trump led Republicans in passing the largest healthcare cut in American history, all for the single purpose of providing tax cuts to billionaires and wealthy corporations. That's where we are. As a result, 15 million Americans will lose healthcare, including 3.4 million Californians on Medi-Cal. For those of us in the region, that is Molina and IEHP. These sound like big numbers, but they have very real consequences. Hospitals will close, children won't get their medication, seniors won't be able to see their doctor, and your neighbors will get sick. This healthcare crisis will only get worse if Congress fails to extend the Affordable Care Act tax credits, which expire next year. That's why my Democratic colleagues and I are fighting to find a path forward on legislation that both keeps the government open and addresses the dual affordability and healthcare crisis that is upon us. If Republicans fail to join Democrats in this effort, Inland Empire families will continue to see their premiums skyrocket. For example, a 60-year-old couple earning $82,000 a year will see annual premiums rise to nearly $14,000. This is unacceptable. At a time when Californians are already struggling to afford everything from gas to groceries, we can't allow healthcare to be another basic necessity that's out of reach. My top priority is to lower costs for Californians, and I'll continue to do everything in my power to fight for you and to communicate your concerns to my colleagues here in Congress. I'm now going to turn it over to Brooks so we can start the Q&A portion of our town hall.
Thank you, Congressman. Our first question is from Vicky from Rancho Cucamonga, and she asked, what are we looking at as losing as far as our health care and with health insurance, and how will this affect people who have existing health issues?
Well, one of the benefits to the Affordable Care Act was the fact that you couldn't get dropped out of your healthcare coverage for pre-existing conditions. So what Vicky is talking about is health insurance companies used to raise premiums and drop people all of the time. That's no more with the Affordable Care Act. And so we have been fighting to defend the Affordable Care Act for the last 15 years. Democrats in the House of Representatives for the last 10 years, I have a track record of defending the Affordable Care Act. This year, their flagship bill that House Republicans put forward was $1 trillion cut in Medicaid. Again, for us, that's Medi-Cal in California. $1 trillion cuts, that triggers a $500 billion cut to Medicare. And for thousands of people, the combination of Medi-Cal being cut and the Affordable Care Act tax credits going away, it's about 50% of our congressional district, 450,000 people potentially could lose healthcare coverage. That's what's at stake here, Vicky, and that's what we're fighting so hard to protect. Now, what they have done is they've tried to play politics with this. To be honest with you, they have ensured that the worst cuts don't go into effect until 2027 because they want everybody to think that things are okay when you go in and you vote for Congress and you vote for federal offices next year. And so they've tried to insulate themselves from the political attack by making all of these cuts happen, many of these cuts happen in 2027. What they failed to calculate is that Health insurance companies have to set these premiums, and they have to set them based on what the conditions look like in the years ahead. And so premium increases are going to continue to happen. And for many of us in the Inland Empire, it might mean that you have a card in your pocket that says you have health care, but the community clinic is closing, or a hospital could be closing. In many places around the country, in rural parts of this country, healthcare clinics and hospitals are already closing. Minnesota, Virginia, all on record, saying that they are closing their doors because of the impending Medi-Cal cuts that are coming in the months and years ahead. So that's why we have been sounding the alarm so loudly about this healthcare crisis that is upon us. And that's why we've been fighting so hard to get the administration and our colleagues in the House Republican side to address these issues. They have not been willing to back off of the cuts and the pain that they are going to impose on our members of the community. It's a shame, and it needs to change, and that's why we're fighting so hard.
Thank you, Congressman. Our next question is from Vicky Lynn in Grand Terrace. Could you address the possible government shutdown? How likely it will occur the next day, and what parts of the government will shut down?
It's a good question. Right now, is we're talking, we're 3 hours away. I'm in Washington, D.C., and we're doing everything we can. House Democrats were here. We were talking about healthcare. We showed up to a session that they had here in Congress, and Speaker Johnson adjourned Congress last week. So there's no formal session going on. House Republicans are on vacation while we have this crisis upon us. And so that is where we are from a California impact perspective. I'll be honest, we're just trying to understand the depth of what this will mean. The administration has broad authority in indicating which agencies and services are essential and will stay open. Many elements of our federal government and many contractors and people who contract services for the federal government will stop working tomorrow, and they may not be paid. Federal employees who are essential have to show up for work. But their checks may be withheld until the government funding crisis is passed. Now they will be paid back pay, but they have to continue to work. What we have heard is that the Department of Homeland Security, Customs and Border Patrol, and ICE will continue to work. Members of the military will continue to work. Our federal postal service will be open, and our post offices will be open. They are a separate system. Social Security checks will continue to go out. So those basic core functions will continue. But I want to just give you a quote that Donald Trump himself said. He said, "We're going to extract maximum pain during the federal shutdown." And his quote was maximum pain upon Democrats. He says, "We will pay a huge price for this." So that's where Donald Trump and his Republican henchmen, that's what they're thinking about. That's what's in their head. They're more concerned about scoring political points and blaming Democrats than protecting Americans' healthcare coverage, which is all we've said we want the focus to be on. So Donald Trump, the guy who supposedly wrote The Art of the Deal, is afraid to be in a room with Democrats to talk about how we can avert government funding crisis. So we will continue to monitor it. I know the state of California is keeping an eye on this as well, on the number of from public parks that are open, national parks that are open, to other partnerships that the federal government has with the state. And over the next 24, 48 hours, we'll have a better gauge on what is open and affected and how it affects the Inland Empire as well. But I would say from our perspective, like Joshua Tree likely would be closed during the government shutdown, but we're awaiting all of that guidance that will come in the future.
Thank you, Congressman. Our next question is from Navarre from Redlands. Why did you travel to Israel with other members of Congress? What was the purpose?
I took a trip to Israel because I wanted to see firsthand what was going on in that region. as we approach the second anniversary of October 7th, more than ever, we need peace in that region and we need to bring the hostages home once and for all. I hope that the agreement that is being discussed right now is a step in that direction. The loss of civilian life in Gaza is a shock to the conscience, and safely returning the hostages and delivering more humanitarian aid to the people in Gaza remains a top priority for me. So I went out as part of a bipartisan delegation to see on the ground the humanitarian aspects of what was going on. We had humanitarian meetings with humanitarian groups providing assistance to individuals in Gaza, to innocent Palestinians who needed help in Gaza. We've also met with the Prime Minister of the Palestinian Authority in Ramallah. We met with the Prime Minister of Israel in Jerusalem. We met with members of the opposition party, as well as folks within government and part of civil society who are trying to help. I think Israel needs to focus on securing the release of the remaining hostages so that the war can end and the hard work toward a lasting peace and a two-state solution can begin. But I'll be candid with you. At this point, after seeing his leadership over the course of the war, I don't trust Benjamin Netanyahu to advocate for an end in good faith to this war. And I don't believe that there is a path to peace while Hamas is still in power and governing in Gaza. So what makes matters worse is the Trump administration and the Biden administration failed to conduct effective diplomacy. And I think that set us back. So we need new leadership in the White House and a new foreign policy approach to get this done. And I would just encourage everyone involved to remain focused on the goal of ending this war, returning these hostages, and starting the efforts at the next chapter, which is a two-state solution within that region.
Thank you, Congressman. Our next question is from Lynette. With these cuts, can we now be dropped from our health coverage if we have pre-existing coverage?
Uh, it is still the law of the land that insurance companies cannot drop people off of coverage. It was one of the most politically popular items within the Affordable Care Act. That has not been eroded, but right now, health insurance companies are seeing that people will get dropped off of coverage, and they will likely have to raise premiums to cover those costs. So healthcare could be more unaffordable. But as of right now, nothing is taking away, nothing is eroding from the potential to drop people from pre-existing coverage. So that is one small benefit, but there are so many other flashing red lights that exist, and I wouldn't put it past this administration to go after that change in the future. But as of right now, it remains the law of the land that you can't drop somebody with pre-existing conditions.
Thank you. Our next question is from Christy in Rancho Cucamonga. And she asked, if the redistricting proposition passes in November, will you still be our representative?
Where was she from? Where was Christy from?
Rancho Cucamonga.
From Rancho. Under Proposition 50, if it's passed, there will be some changes that affect Rancho Cucamonga. And I'm not sure, depending on what your address is, if I would be your representative or if Judy Chu would. If you've been in that address for a little while, Christy, you know that I represented part of Rancho Cucamonga from 2014 to 2021, and then a little bit of a different part in the last couple of years. So these lines, every redistricting move just a little bit. What I would tell you about Proposition 50 is that about 75% of the state of California is unchanged in their representation. In our region, it's probably closer to 95% doesn't change. Whoever your representative is today would be your representative next year if the ballot measure passes. We're only doing this, and California is only engaged in Proposition 15, putting it before the voters, because Texas responded to a call from President Trump when he said, find me 5 congressional seats Donald Trump knows his agenda because he's going after healthcare. He knows his agenda is unpopular. And the only way that he stays in power is to rig the elections that happen next year in 2026. Right now, House Democrats are at a three-seat disadvantage from taking the House and changing the tenor and the tone of what's happening in Washington and providing true oversight and accountability. But Donald Trump doesn't want that. And so after he passed this bill that assaulted our health care, he went to his friends in Texas and said, find me 5 seats, just like he went to Brad Raffensperger and said, find me 10,780 votes after the 2020 election. And so Texas did his bidding and they changed their maps. By the way, Missouri, Indiana, Kansas, Ohio, and Florida are all looking at changing their maps to give Republicans an advantage. In California, our legislative leaders and the governor said enough is enough. We're not going to succumb to this and we're going to push back. And so we're going to redraw our maps. But unlike those states, we're going to put the maps in front of the people. We're going to let people vote on this. In all of those other states, the legislature, a Republican-led legislature, and a Republican governor can just sign those maps into law. California, we're taking it to the voters and we're saying, this is what's happening around the country. Will you give us the tools to forcefully push back? And it's going to be up to California voters. I will respect however they vote on this issue. If they vote yes, that it is likely that Democratic representation in California will go up, potentially by as much as 5 seats. And it's likely some of the changes, some of these lines might change in Rancho Cucamonga and in Fontana that affect the Inland Empire and my representation on a border with Judy Chu and Norma Torres. That would be the effect of Proposition 50. But I encourage you to listen to the advocacy on both sides and read the ballot measure. You'll be getting your ballot in a matter of days. And just encourage everybody on here to exercise your right to vote.
Thank you, Congressman. Our next question is from Sestri Pantula. I'm concerned about all of the things you mentioned about healthcare coverage. I am also concerned about all of the federal employees. How can we support them during the budget impasse? I have been so concerned about how many federal employees who lost jobs during DOGE cuts and the impact worldwide with aid.
It's a great question, and I appreciate the compassion that you have for people abroad. One of the biggest changes that President Trump put into effect on day one was cutting this foreign aid, literally leaving aid workers who are providing services around the world, leaving them high and dry, telling them to pull their kids out of school. And to fly back to the United States, that their contract was done. Meanwhile, people continue to need food and need resources around the world. And the U.S. was providing that diplomacy. We were helping avoid wars and famine around the world by providing a small amount of aid. And under Donald Trump's leadership, that is all now gone. And then you compounded DOGE and the cuts that the president put into place. And in the last couple months alone, the president's cut billions of dollars in additional services and support that the United States provides around the world. And all told, it's hundreds of billions of dollars that Donald Trump and his administration have not spent for their intended purpose. This is everything from Department of Education to cancer research. All of that is at stake. And so when people say, oh, just keep the government funded for another 7 days, another 10 days, another couple weeks, and continue, our communities can't take this. Our communities are struggling, and Donald Trump is withholding resources that Democrats and Republicans have signed on to. Compromise deals that both parties have agreed to and have said, we're going to spend at this level. And then Donald Trump is upending that, and he's spending less than that level, half of that, none of that. And my Republican colleagues in Congress just stand by and they don't push back on him for not allocating this money. So I don't know if they're unwilling or unable, but it is a shame that they continue to allow him the ability to change this, to fire people. So I'm concerned about his potential to fire employees. As we saw with the chaos of Doge, people were doged and fired, and then months later they were brought back to do the work because they knew that the work needed to get done. So I don't know what the future holds, and I feel terribly for these employees who Donald Trump wants to continue to use as a pawn. But we can't bless this lawless behavior that he continues down.
Thanks, Congressman. Our next question is from Zira from Fontana. What can be done to ensure middle-income families in California who face high living costs and do not qualify for subsidies are not left behind when healthcare premiums rise, since low-income households receive assistance and higher income households can usually afford the increases?
Yeah, unfortunately, what House Republicans have put forward, it would affect you and your family. It may not be January. It could be January if you receive the premium tax credits and you get your health care from healthcare.gov, or it could be in a year from now if you're on Medi-Cal. We are telling the House Republicans right now, our message is very simple: cancel the cuts, lower the cost, fix healthcare. That's what we want. They could also cancel their vacation and come back to work in Washington, D.C., but cancel the cuts, lower the cost, fix healthcare. That's what we can do. I'm afraid that your family could get caught up in this. And what Republicans have sought to do is they've added these work requirements to as a prerequisite to get care. They don't understand that people in the Inland Empire who can work do work. They don't understand that many of the people on Medicaid are children, are veterans, are disabled, or are seniors. So that's the system that they have created, where 90% of folks fall into one of those categories, and they're still saying that we need these work requirements, and they're using them as a prerequisite. 52 cents out of every Medicaid dollar goes to nursing homes. And so this affects our seniors as well. 52 cents, over half the money into Medicaid goes to nursing homes. And one of the things that they have done within this bill is to say, you need to fill out more paperwork. And if you don't fill out your paperwork correctly, we're going to kick you off of care. So there's a potential for them to push people out of nursing homes out the back door, all because the paperwork wasn't done on time, or seniors didn't know they had to fill out paperwork 2 or 3 times a year instead of maybe once annually. That's what you and your family have in store, and we're doing everything we can to cancel these cuts to make sure that people don't get dropped off of care. But we're going to need a lot of help. We're going to need people to make their voices heard. We're going to need people to say enough is enough, and that Republicans need to stop this assault on healthcare. We had a lot of Republicans, even some from the state of California, express some reluctance, some ambivalence about proceeding down this path to assault healthcare. And in the end of the day, they all folded. They all carried Donald Trump's water. They all passed this bill. Some of them got a promise that maybe we'll spend a little bit more here and these rural hospitals, or no, we're not gonna hurt those folks. But the law is very clear, and they were coming after healthcare. I'm afraid that you and your family and Inland Empire families are going to bear the brunt of it.
Thank you, Congressman. Our next question is from Sandy, and she asked, when will the newly elected House member from Arizona be sworn in?
Yeah, I appreciate the question, Sandy. There was a new House member who was elected resoundingly last week on Tuesday. And it has been the practice of the House of Representatives to swear in new members of Congress very quickly if the election is not contested, if it's not close. In some cases, just a couple weeks ago, we swore in a new member, a Democrat, less than 24 hours after his election. And Adelita Grijalva was elected last week. We had a session today. They could have sworn her in, and they chose not to. And they chose not to because they did not want her to sign what's called the discharge petition. Her signature would be the 218th signature on a discharge petition that could force the release of the Epstein files. And House Republicans have been asked by Donald Trump not to go forward with this. We don't know why. We can speculate. Some public documents have come to light that have said the president's friends, from Elon Musk to Peter Thiel, have been listed in these Epstein files. Maybe he's trying to protect them. Maybe he's trying to protect someone closer to his family. We don't know. But we don't know unless those files are released. Donald Trump himself advocated to release these files. Members of his administration have advocated to release these files, including the FBI director, including the president's own son. His attorney general said that there were Epstein files on her desk that were going to be released. So we don't know what they're hiding. But that probably means that that's the reason why they're not swearing in our newest member, which would be Adelita Grijalva, and she would be the 214th Democrat serving in the House of Representatives. And she would be the 218th signature because some Republicans have signed on to that discharge petition. So stay tuned. We hope that she is sworn in at the first possible opportunity, which might be as soon as next Tuesday.
Thank you, Congressman. Our next question is from Erica, and she asked, are we at all insulated in California through Covered California, or is it all tied to the ACA?
Yeah, Covered California is part of the ACA. So the premium tax credits is part of California. They are embedded in the state of California has created a robust network and system as a part of it. It has dramatically reduced premiums by using the shared buying power of folks in the state. This applies for small business owners and folks all over the state who previously who may not have employer-sponsored healthcare. And so all of that is at stake, and the potential for these premium increases to rise are very, very real. For those of us in California, this could mean a couple $1,000s increase in our healthcare premiums. And so that's what we are fighting against. That's what we're advocating for. Enrollees who are above the age of 55 could face $2,000 a year in the extended tax credits, with around 6 million individuals receiving federal subsidies. This group could see a price hike of almost $10,000 to their yearly premiums. Covered California announced a premium increase of 10% in effective for the next year. In a couple weeks in October, they're going to be informed about rate increases if we can't avert this crisis with the tax credits. And so if you are on the Covered California, stay tuned and stay close to your plan. Our hope and our push is that we're trying to add some certainty to this. We're trying to ensure that these tax credits continue for permanently or for the next few years to avert those premium increases. But middle income families, especially families making $106,000 for a family of three or $62,000 for an individual, could face 400% or could face an increase of $6,000 in their annual premiums. So this is very real. It could mean hundreds of dollars a month, thousands of dollars a year that Inland Empire families have to pay in addition to what they're paying now.
Thank you, Congressman. Our next question is from Vanessa in Rialto. I have an adult son who is physically disabled, and I constantly worry about healthcare for him. How do we continue to fight for those who are physically disabled and need medical assistance?
If you're also a caregiver to your family member, yeah, I just want to tell you, I think that that is so amazing to be able to do that and the adversity that Inland Empire families, have to face. And I don't want families having to choose between providing care for their loved ones and having to go work. Oftentimes, family members are absolutely employable and can go work, but if they choose to do that, they still have to pay for care for their family members, for their disabled family members. And so those are difficult decisions. I can't imagine what goes into that. But I want to tell you that we continue to think about you and the work that other caregivers provide. Now, we want to ensure that the Medicaid that you are likely on continues. And so the importance of providing Medicaid to provide care. I talked to, sat in on a roundtable with some Inland Empire families, and one woman had indicated that her disabled son, her disabled kids, received Medi-Cal, got their health care from Medi-Cal. But she received her health care from the Affordable Care Act. And so many of these families are pinched because both could be affected. Now, the Medicaid has a potential to go away under the plan that Republicans have proposed, and the Affordable Care Act premium tax cuts credits potentially could go away starting next year. And so we're very mindful of that. Right now, the premium tax credits would expire at the end of this year and go away for next year. And so that would mean, just like I said previously, hundreds of dollars a month, thousands of dollars a year for the individual caretaker. In that example, the caretaker's healthcare coverage, the Medicaid for the disabled individuals and the people you're providing care for could continue, but it depends on a host of other factors that could come into play as well.
Thank you, Congressman. Our next question is from Daphne in Rancho Cucamonga, and she asked, "Why did you vote yes for the Charlie Kirk resolution?"
Yeah, I appreciate the question, Daphne. For those folks who weren't paying attention is closely. There was obviously many of you saw on the news the assassination of Charlie Kirk, who was a conservative, an individual who espoused conservative beliefs and had a following. I voted yes. There was a resolution on the House floor honoring him. And I voted yes because the resolution resoundingly condemned political violence. And I think political violence on every side of every kind needs to be condemned. When the Minnesota former Speaker of the House was assassinated at her door, Democrats and Republicans stood and condemned political violence and passed a similar resolution to this. Now, I didn't agree with everything that Charlie Kirk said. I didn't agree with a lot of what Charlie Kirk said. I viewed this resolution a little bit as a eulogy to him. That I wouldn't stand up if someone was being eulogized and say, I disagree. If I was at that service, I don't have to agree with it, but it resoundingly opposed political violence of all kinds. That's why I voted for the measure. I understand that many people disagree with all of the beliefs that Charlie Kirk conveyed. And I'm probably in that category, although I have to admit, I have not seen a lot of I've seen some clips, but I'm not as familiar with him and did not follow him before his passing. But political violence has to stop. We've seen now individuals shot who were in ICE custody and individuals who were being detained by ICE. I don't know if the target was law enforcement or the target was the individuals who were shot, but people, I believe two now have passed away as a result of that. You saw just this weekend the violence and the arson and the fire and the killing of members of the Church of Jesus Christ of Latter-day Saints in Michigan. All of this that has some political overtones is wrong and needs to be condemned. And there are people like Charlie Kirk who spewed a lot of things that were hateful and they were wrong. That doesn't mean that that they should be subject to political violence. And so I believe that there should be space for everybody to have, conversations and to disagree. And so I voted yes for that resolution for with that in mind. I appreciate the thoughtful question, and I have to tell you, I struggled with this and talked to my staff members a lot about this, and talked with family members about this resolution, and ultimately, Democratic leadership and many members of the House Democratic Caucus voted yes.
Thank you, Congressman. Our next question is from Sandy, and she asked, do you think Trump's military meeting is a preface to place the military staff in the cities and then use it to cancel or postpone next year's election?
The answer is yes and maybe. I believe that his address and the Secretary of Defense's address to military leaders was wrong, and the fact that they are indicating, they might use American cities as training grounds. This is against the law. We saw this. We were the first to see it in Los Angeles. We saw Donald Trump seek to erode our rules and our norms. That's who he is. And thankfully, the governor of California and Senator Padilla, they all pushed back. Senator Padilla, was a victim of violence for showing up and asking questions. And he was taken down and assaulted by federal officers. That's just wrong. But it's also wrong to stage U.S. service members in U.S. cities. That's a violation of posse comitatus, which prevents members of the military from being used for domestic law enforcement purposes. We need more law enforcement professionals, local police, local sheriff, all saying that. This isn't playing politics. This is following the U.S. Constitution and our laws. Local police officers are responsible to protect us in our streets. The U.S. military is responsible to protect us from threats abroad. And that needs to be the clear line. But Donald Trump doesn't care about lines. And I am afraid of what happened today, and that it could lead to more U.S. service members being placed in harm's way around the country, or subjecting themselves to being called out if they're a National Guard as well in U.S. cities. Now, one of the things that is Donald Trump will try every intimidation tactic possible, including potentially calling out the military when it comes to election day and voting. We can't be intimidated by it. And just keep in mind, the election in 2026 will be monumental, because who we choose in 2026 will guide whether we have a free and fair election in 2028. And I'm afraid there are some flashing yellow lights and red lights that tell us we should be deeply afraid of having a free and fair election in 2028. And so that makes 2026 all the more important. And that's why I'm trying to do my part to raise oversight and accountability, and to make sure that we provide a check on Donald Trump.
Thank you, Congressman. Our next question is from Larry, and he asked, what is your position on Secretary Hegseth forcing members of the LGBTQ community out of the armed services?
It's wrong, and it's shameful. It makes me sad, makes me sick. Members of the LGBTQ community have served our country honorably. They've done their job. When someone signs up to the military, they take an oath to the Constitution, and all they are seeking to do is to serve. That's all they want to do. And they should be allowed to serve our country. And shame on Pete Hegseth and Donald Trump. By the way, Pete Hegseth has to be the most, unqualified. I think it goes without saying, the most unqualified Secretary of Defense that we have ever had. Watching a little bit of his speech today, he's polished, he's slick, he has a nice suit, he's got nice hair, but he's a con man. He's a con man and deserves to be, on TV, back on Fox News, or selling things on late night TV, or whatever his future jobs might be. But he should not be in a position of this much power. It's wrong. The decisions that he has made about LGBTQ members and the military is wrong. Today, he just continued to say women cannot serve in combat. I believe that is wrong. And I believe women have been serving in combat roles, and they have been performing exceptionally well in those roles. But Pete Hegseth doesn't believe in equity. Pete Hegseth believes in turning the clock back 60 years. That's what he wants to do. And in that speech, you heard him tell folks, if you disagree, just resign. They want to fill the armed services with people who only believe the way that they believe. It's wrong. People who serve in their military take an oath to the Constitution, not to a president, but to a Constitution. And so my rebuttal would be to members of the military, stick around, do your job, be guided by the rule of law, guided by the Uniform Code of Military Conduct, and be guided by the U.S. Constitution, and continue to serve. Because if you're not there, these folks are going to continue to fill the ranks with their henchmen and sycophants who will just do anything that they want, including carry out their bidding to stage members of the military in U.S. cities. And we can't have that.
Thank you, Congressman. Our next question is from Carlos in Rancho Cucamonga, and he asked, will Donald Trump exploit the looming government shutdown to hurt Social Security or Medicare?
It's a good question. And I don't know. I mean, again, the quote I read before was Donald Trump said we're going to extract maximum pain during the government shutdown and that we're going to pay a huge price. I think, excuse me, in the Oval Office, he said that he could go after popular programs, and I interpreted that as meaning programs that Democrats and people around the country care about. And so he could be opening up the door to Social Security and Medicare. No government shutdown has stopped Social Security checks from coming into your accounts. Social Security is a benefit that you have paid for, and we will work to make sure that you receive that benefit. Now, Donald Trump doesn't like to follow the law. And so if Donald Trump wants to stop Social Security checks, or if he wants to stop support that people rely on, he may try to do that. And our only way to push back is through the courts. And we will be ready to do that. House Democrats, I have signed amicus briefs pushing back against the lawless Trump administration a number of times. The courts are moving incredibly slow. And this highest court in the land is stacked in his pocket. But we will continue to do the right thing and ensure at every opportunity that you receive the benefits that you are entitled to.
Thank you, Congressman. Our next question is from Michael from Rancho Cucamonga. Will House Democrats continue to push for the full release of all of the Epstein videos, pictures, diaries, everything?
All of it. All of it means all of it. Everything that the Department of Justice has, every file, every document, every transcript, every recording, the Oversight Committee, which is the ranking member, the lead Democrat on this committee, is a Democrat from Long Beach, Robert Garcia, who's a former mayor of Long Beach. Robert's an amazing individual, and he and his committee have been doing a lot of work, generally working in a bipartisan basis to depose individuals who were associated and part of the Epstein court case, including a former member of Trump's cabinet who was the U.S. attorney at the time that that Epstein received a sweetheart deal and didn't serve a lot of time for his crimes. And so they deposed him and asked him a lot of details. But everything means everything. All the files, all the work, all of it should be made public. And if Adelita Grijalva is sworn in, and if she signs, I'm confident she will sign the discharge petition, then the House will be forced to act on that. And that could mean a vote to release all of these files. It would then go to the Senate, and obviously it would have to work its will and work its path in the Senate. But at least it sends a resounding bipartisan message that we want all of these files released. And so I would say, to answer your question, all of it means all of it. And Democrats like Vice Chair of the Democratic Caucus, Ted Lieu, have been saying this for a long time. Release all the files. So we're going to continue to ensure that we provide oversight and accountability on the administration to release all the files.
Thanks, Congressman. Our next question is, how can you help CSUs, UCs, and community colleges who have lost research funding and workforce development? It's having an impact on scientific discoveries and training future problem solvers. This is a long-term impact, easy to break, but very hard to fix. What are your plans to reverse this downward spiral?
Research dollars are drying up for our institutions. They also have sought to go after the Hispanic serving institution category and local funding that goes to local colleges and universities because we are Hispanic serving institutions. Time and time again, the administration has tried to go after these grants and programs. And the sole purpose of these grants and programs is to provide resources for flexibility for our local universities, allowing them a small amount of money so they can continue to provide resources and offer programs for first generation students and continue to perform research at high levels that will lead to new industries and innovation from the Inland Empire. But I'll tell you what I'm very concerned about. Two things in education. One is Donald Trump saying he wants to eliminate the Department of Education. And with it could mean Title I funding that is hundreds of millions of dollars to Inland Empire schools goes to Title I funding. And on the higher education side, I'm concerned about cutting federal Pell Grants, which is exactly what House Republicans and Donald Trump have sought to do. And I think we can hold them off, but they've sought to cut Pell Grants. And a significant majority of students in the Inland Empire who go to community colleges, who go to Cal State and UC, Cal State San Bernardino, and UCR, and institutions around the Inland Empire utilize this Pell Grant, and they want to cut it $1,600, $1,800 per student. That would mean millions of dollars of lost revenue that these institutions would have to make up, and many of them wouldn't be able to do it. And many students wouldn't be able to fill that need of financial aid. And as someone who received a Pell Grant to go to college, I can tell you that every dollar matters. And so that's what I'm deeply afraid of when it comes to cuts in education funding, the research dollars, the Hispanic serving institution designation, and those dollars that are being withheld. In addition to Department of Ed, Title I funding, and Pell Grants. I mean, all of this is a collection, and part of that, $400 billion that is being withheld by Donald Trump and his administration, not being spent for its intended purpose. That's a huge concern for all of us.
Thank you, Congressman. And our last question is from Joe in Redlands, and he asked, let us know the specific healthcare related things the Dems are looking for in order to agree to a budget deal.
Yeah, I mean, this is part of a negotiation. So we are talking about meeting the needs of the American public. We are talking about providing healthcare to the American people. There are nearly 400,000 people in my district who rely on Medi-Cal. All of that is being threatened by House Republicans' actions. So we are telling them take your hands off of our healthcare and come to the table. And so, at a minimum, have a conversation with us about these premium tax credits that are set to expire at the end of the year. But any agreement to protect Americans' healthcare has to be solid. We can't have false promises about what Republicans, will do. We need to see it in writing that they will actually address these needs. And so that's what we're hoping to accomplish. And that's what we want to get done. But House Republicans have to meet us. They have to meet with us to talk about the importance of protecting healthcare and what we can do. Stop undermining healthcare, start negotiating with us to improve our healthcare system. And so that's what we are seeking to do. We are now 2 hours from a government shutdown, and we want to make sure that we're doing everything we can to cancel those cuts to healthcare. But in order to do that, House Republicans are going to have to cancel their vacation and come back to Washington, D.C. and work. Brooks, I want to thank you for moderating this. Again, you did a great job. And I want to thank all of you for joining me tonight in this virtual town hall. I always enjoy hearing from you and answering your questions about my work in Congress and about what's going on in DC right now. I'm sorry that we ran out of time and we couldn't get to everyone's question, but I did want to leave when everybody had enough time to watch the Dodger game this evening. If you have any other questions that you'd like to ask, please visit my website at aguilar.house.gov to send us a message, ask a question, or request assistance. As always, I'm proud to be your representative in Congress, and I hope that this was informative for all of you tonight. Thank you again, and have a good night.